There's an invisible crisis in our country. There's a group of young people who grow up disconnected from the people who care about them and are forced to face adulthood on their own. I'm talking about the youth who age out of foster care. Most young adults receive support from their parents through their 20s, but youth who age out of foster care are abruptly pushed into adulthood when they reach a certain age, like 18 or 21. Their services end, and we expect them to be independent. But most aren't ready. They were in foster care, so they often lack the relationships that they need to be independent. For nearly all children, healthy relationships develop through involvement in family life and through activities in school and other organizations. Growing up without these relationships raises the odds for a poor transition from adolescence to adulthood. It's particularly difficult for youth who have been in foster care. Many of their lives have been disrupted by child abuse and neglect. They don't develop these relationships to sustain them in the transition from foster care to adulthood. And then we live in a world where instead of prioritizing relationships, we prioritize skills. The lack of relationships and the lack of skills collide and leave youth aging out of foster care vulnerable to a world that hasn't supported them, a world that is even more challenging when forced to face it on their own. Independence before a young person is ready and without a caring adult to turn to creates a crisis. So, instead of prioritizing independence, we must prioritize interdependence for young people aging out of foster care. Interdependence means knowing you have someone who will always be there for you, a trusted adult ready to help you face life's many challenges. Interdependence is that undeniable sense of belonging and having a place to call home, whether a physical place where you lay your head or an emotional place with people who care for you and about you. But for youth who age out of foster care, our child welfare system stops being concerned about relationships for them. It stops working to make sure all youth, regardless of age, have a place to call home. As a result, each year, tens of thousands of young people age out of foster care without a permanent connection to a caring adult. We've invested our public resources in programs intended to teach them skills, but where has it gotten us? Nowhere. These young people are at high risk for unemployment, low educational attainment, reliance on public assistance, homelessness, and more. Every number is against them, and society accepts that they are throwaway kids. Not only is it costing them their lives, society pays the price too. On average, for every young person who ages out, taxpayers and communities pay $300,000 in social costs over that person's lifetime. With approximately 26,000 young people aging out each year, this amounts to nearly $8 billion in total costs. A decade ago, while I was working on my PhD, I learned about a 40-year longitudinal study. This study followed nearly 700 infants born on the Hawaiian island of Kauai starting in 1955. Results of the study over the years support our conventional wisdom that children exposed to risk, like child abuse and neglect, go on to experience more problems with delinquency, mental and physical health, and family instability than children not exposed to such risk. But 1/3 of all the children in the study displayed resilience and developed into caring, competent, and confident young adults despite their histories. You're probably wondering what made the difference. A lot of factors, but one of the most important was a strong bond with an adult who was not a parent, like an aunt, uncle, grandparent, teacher, coach, neighbor, or pastor. I then asked myself the same question I ask you here today. What if every young person who aged out of foster care did so with a permanent connection to a caring adult? What then would their lives look like as they entered adulthood? I believe, as many child development experts believe, the power of every child having one adult who is irrationally crazy about them is one of the greatest resources that we have to offer young people. The presence of at least one caring, committed adult can make all the difference in the lives of youth who age out of foster care. Someone who helps that young person to weather life's challenges and face adversity and supports them to not only survive, but thrive. I've developed a theory-based, research-supported intervention called CARE, which stands for Caring Adults Are Everywhere. CARE facilitates and nurtures interdependence among older youth in foster care. CARE is built upon a resilience perspective that all adolescents need caring adults in their lives. First, we help youth identify caring adults. Then, we nurture and support those relationships over the course of several months. The ultimate goal of CARE is to strengthen the social networks of young people aging out of foster care. So when the program ends, the relationship not only continues to grow, but also is a source of support for that young person as they age out. I'm urging our country to rethink how we prepare young adults aging out of foster care. We need a new model, one that promotes interdependent living. CARE is just one example of how we can accomplish this. I'm sure we've all had a lot of adults in our lives who were important to us and who were not our parents. People like aunts, uncles, grandparents, teachers, coaches, neighbors, and pastors. I was fortunate to have a handful of caring adults like this in my life: a piano teacher, a guidance counselor, a camp director, teachers in high school, professors in college and graduate school, and even a boss. Youth in foster care will experience improved lives when they too have strong social support networks. These networks must include at least one adult who is not a parent. This is how we begin to heal the aging out crisis. I want to leave you with this: 3 calls to action for those who share my vision to care for young people aging out of foster care, to help them connect instead of disconnect. First, reach out to a young person in foster care and be that caring adult in their life. Next, educate. Talk to your local child welfare jurisdictions about serving older youth in foster care by supporting their interdependence, not independence. And last, encourage. Petition policymakers to pass legislation that mandates interdependent living programs, ones that work to nurture relationships between caring adults and youth aging out of foster care. Let's stop expecting youth aging out of foster care to be independent and just survive. We must give them someone to depend on, help them be interdependent and thrive. I love the sentiment of Josh Shipp. He's a former at-risk youth in foster care who's now a motivational speaker and best-selling author. He says, every kid is one caring adult away from being a success story. Let's commit to this vision for older youth in foster care. Let's build this dream together. Thank you.